Hello, I am Dr. Ehab, Professor of Orthopedic Surgery working in the International Medical Hospital. Today, we have one patient, Mrs. Saida. This is from India. This is 88-year-old female, have bilateral breast cancer since 25 years and bilateral total knee since 12 years and diabetic, hypertensive, cardiac, and have severe trauma of the left hip leading to comminuted trochanteric, subtrochanteric, proximal femur around 20 pieces. For this challenging case of hip comminuted hip fracture in old age with also total knee replacement, the patient cannot be put in the normal traction table for operation to reduce the fracture. It is challenging for do the operation internal fixation or do total hip replacement. This patient tolerates the operation only 2 hours with unique technique to reduce this complex comminuted displaced fracture without any traction table, without traction, using open percutaneous reduction, and then using special titanium dynamic hip screw with special leg screw for different piece of bone, and the patient second day can move his leg and tolerated no pain, less pain, no edema, very minimal edema, and passive and active exercise of the whole left lower limb, and this give him chance for better quality of life that can be returned to normal life after 2-3 months with complete full wood pairing. Thanks.
हमारे डॉक्टर बहुत ही अच्छे हैं। उन्होंने बहुत अच्छी तरह हमको समझाया कि ऑपरेशन में डरो मत, कोई तकलीफ नहीं होगी, और हर दम वो आके मुझे समझाते रहे किस तरह हम ऑपरेशन करेंगे, और कोई दर्द नहीं हुआ, और इंशाल्लाह उन्होंने बहुत अच्छी तरह हैंडल किया, और मेरा ऑपरेशन सक्सेसफुल रहा। ऑपरेशन के बाद हम बहुत कंफर्टेबल और हमको इत्मीनान हो गया कि हमें कोई डरने की फिक्र नहीं है, हमारे डॉक्टर हमारे पास हैं। और उससे पहले हम हॉस्पिटल आने के लिए डर रहे थे कि हम नहीं जाएंगे हॉस्पिटल, लेकिन इन सब ने समझाया और डॉक्टर ने हमें बहुत अच्छी तरह समझाया, इसके लिए मैं राज़ी हो गई ऑपरेशन। बहुत अच्छी तरह सबका ट्रीटमेंट था और बहुत ही हम होमली फील कर रहे थे, तो कुछ तकलीफ नहीं हुई। सिस्टर्स भी बहुत अच्छे हैं, डॉक्टर भी बहुत अच्छे हैं।
Hi, my mother Saida Ahmed had a fall in our villa, and we thought it was something very minor, but when we got her in an emergency vehicle to the International Modern Hospital, which was by luck and godsend, we were introduced to Dr. Ehab, who was the head of the orthopedic department, and we were surprised really to have interacted with this kind of an intellectual in Dubai. Tell you frankly, I have seen only this kind of talent in Germany or in England or in not even India, but the way he understood the case after seeing those CAT scans and those x-rays, and we realized that there were multiple fractures on the neck and on the stem. They were like the fractures were to a level where it was into fragments, into more than a dozen of them. Mother is 88 years with diabetes, hypertension, comorbidities. Dr. Ehab could have easily made a lot of money from me, but he didn't, because I was telling him to do a total hip replacement, which is expensive. He says, no, you don't need a total knee replacement, it will not work, because your mother's had total knee replacements, 2 of them, and if you do a total hip replacement, it is going to eventually prevent the rectification in case the knee has a problem later on in life, and we would be stuck. And the stem would be going to 32 inches, which was again tremendous. So he recommended that I do something which is a piece of art, where he would be stitching each and every fragment with the K-wire and then joining each of them, and then using a dynamic angular screw, he would be fitting everything in, which is, believe me, impossible normally, the way for such a senior patient who is 85. I must say that Dr. Ehab had, normally a surgeon would maybe not even take this case, but Dr. Ehab was well versed, and he, being a professor and a double PhD if I'm not mistaken, had the patience to sit down with me for sweet 1.5 hours explaining each and every element of the procedure, how he's going to do it, what he's going to do, and what are the kind of risk involved. We are going to possibly have a fat embolism coming in, and we could even have deep vein thrombosis, but my fear has always been fat embolism and pulmonary, that too, because of the patient. And he told me the protocol. He told me that he's going to, within 12 hours of the operation, he is going to start blood thinners, which is again very, very rare, because most of the orthopedics in this part of the world and even in India, which are used to, do not start these blood thinners before 24 hours. Dr. Ehab had the confidence and the protocol, German protocol, which he followed, to start the blood thinner in 12 hours, because that would prevent. The most dangerous thing in these kind of surgeries is fat embolism, and he would prevent that. That is something which I got tremendously impressed with, his confidence, his preparedness, because before the operation, 1.5 hours he sat down and explained to me, and before he went handling this jigsaw puzzle, unlike normal doctors, he actually worked on each, after the CAT scan, he worked through each and every piece and how he's going to fix it together on paper for 45 minutes before the operation, showed it to me, and then he went in, which is rare. I mean, he knew, and I asked him about osteoporosis for mother because he didn't do a density scan. He says no, he calculated the condition of a bone from the triangle theories, from the basics, which he did it, which normally no orthopedic is in touch with today. They will always say, go get a scan done and get your bone density. But this Dr. Ehab said, no, I trust myself more than machines. Then one very important thing, he says, I would rather trust your normal bones than your metal bones. Let your mother have a chance in life. These are something which you don't get in normal doctors. And he is he is a professor, he knows his, he goes by the book rather than he's going by intuition. So there's something, he prepares and gets it done. This kind of case, I would have never got it done in Dubai, tell you frankly, because it's a geriatric case. And in Dubai, normally I've seen people are used to handling young people. Dr. Ehab handled this case, and Dr. Ehab told me why I got convinced. He showed me a case where he's handling a person of 102 years. So here we have a doctor. I must say, International Modern Hospital has a gift of God here, which I think humanity too should take advantage of. Dr. Ehab, he's a very modest man, he doesn't talk much, he's not marketed well, but I think we have a gift to mankind out here and we should use it. It's not there really in India also. So I'm very impressed. It's not that it's just my mother, but we are all in the same profession, and we do understand that this is, he's on a piece of art, and he is an artist and a professor. And a person who's experienced, he's been doing more than 1,000 cases every year. I'm saying when he was practicing, doing his PhD at the University Hospital in Germany. So all the best, Dr. Ehab. I wish that people are able to get benefit of your expertise, and inshallah, I pray to God that people are able to get more and more of your help. Thank you very much.